The following video will show you how to inject subcutaneous Pergoveris at home. Pergoveris is prescribed to stimulate the ovaries to produce follicles containing the oocytes. Before you begin, check against your KKIVF Center injection form to ensure that subcutaneous Pergoveris is ordered for the day. Do administer the medication at the same time each day. Then, practice proper hand hygiene by washing your hands with soap or use a hand sanitizer. Next, prepare the following items. 1 Pergoveris Pre-filled Pen. Inspect the medication. Ensure the medication is clear with no particles and that it is not expired. 1 single-use needle. 2 pieces of alcohol swab. 1 container for disposing the injection, such as a disposable plastic bottle. Step 1. Set the dose. Remove the cap of the Pergoveris pen. Turn the dose setting knob until your prescribed dose appears in the dose feedback window. If you go past the dose you require, turn the dose setting knob backwards to the correct dose. Step 2. Attach the single-use needle. Clean the rubber inlay on the cartridge with an alcohol swab. Peel off the seal on the single-use needle and screw it tightly into the tip of the cartridge holder. Step 3. Remove the needle shield. Remove the outer needle cap by pulling it gently and keeping it for later. Then, expose the needle by removing the inner cap. Step 4. Inspect the injection site. Inspect your skin to make sure there's no bruising, swelling, hardness, or irritation in the area of the injection. Step 5. Clean the injection site. Clean the selected site with an alcohol swab and let it dry thoroughly before the injection. Step 6. Administer the injection. The injection can be given anywhere 2 fingers below the navel. Use a different injection site each time to lessen the chance of damage to the tissues under the skin. Hold the injection pen with your dominant hand and ensure that your thumb can reach the injection button. Firmly pinch the skin with your thumb and index finger and hold it. Inject the needle into the pinched skin at a 90-degree angle. And slowly push the injection button until the dosage marker reaches 0. Wait for 5 seconds. Step 7. Withdraw the injection. Lastly, replace the outer needle cap and unscrew the needle by turning it anti-clockwise. Discard it into the disposable container. Use an alcohol swab to apply light pressure and gently wipe the injected site. Store the medication between 2 degrees Celsius to 8 degrees Celsius. Do not freeze it. Thank you for watching this video. We hope that it has been informative.